In 2016, we will maintain the current PPO 2000 plan, but also add a second option, both through Blue Cross Blue Shield of Massachusetts. The first plan being offered is the PPO 2000, featuring the following components. An individual annual deductible of $2,000, which increases to $4,000 if more than one person in your household is being covered under the plan. Preventative services, as defined by the Affordable Care Act, including annual physicals and well child visits, are covered at 100%. All other medical visits and services, with the exception of prescription drug costs, are subject to the annual deductible. Once any one covered person reaches his individual deductible, then most services are covered at 100%. The remaining covered persons combined must reach the next $2,000 before their medical services are covered at 100%. One of the advantages of this PPO plan is that prescription drugs are available at stated copays, again without having to pay a deductible, from day one of the plan year as follows: $15 for generic drugs, $30 for preferred brand drugs, and $50 for non-preferred brand drugs. The plan also contains an out-of-pocket maximum for prescriptions, so that once an individual pays $1,000 for prescriptions, $2,000 for a family, then all prescriptions will be covered at no cost for the remainder of the year. The new plan option for 2016 is called the Blue Care Elect 2700. This plan features the following: an individual annual deductible of $2,700, which increases to $5,400 if more than one person in your household is being covered under the plan. The same preventative services we identified for the PPO 2000 plan are covered at 100%. All other medical visits and services, including prescription drug costs, are subject to the annual deductible. If you are purchasing healthcare coverage for more than one person under your plan, then any one covered person can reach the annual deductible of $5,400 for services or prescription drugs that they require during the year. This feature is known as a non-embedded deductible and is an important distinction from the PPO 2000 plan. Once the annual deductible has been met, then most remaining medical services are covered at 100%. Prescription drugs would then be subject to copays as follows: $10 for generic drugs, $25 for preferred brand drugs, and $45 for non-preferred brand drugs. A major benefit of this plan is that you are able to set aside money from your paycheck on a pre-tax basis into what is called an HSA, or health savings account. Money that you set aside in your HSA can be used to pay the cost of your medical services and prescription drugs. The money goes in pre-tax, accumulates without taxation, and can be used to pay for qualifying expenses without taxes being applied. Any money that is left over at the end of the year remains in your account for future use. We hope this summary has been helpful. Please note that it is intended as a high-level overview, and you should consult the plan SBCs and certificates of coverage for exact plan details. Please email benefits@beaconhillstaffing.com should you have specific questions.